So, good evening and thanks to everyone for joining us today. Jagsonpal Pharma welcomes you to the webinar today organized by Allahabad Menopause Society presenting Menopause, the Dawn of New Era. The technical partners for this webinar series is Nari, Boniva and Fembon divisions of Jagsonpal Pharma, makers of Memup, Doxipel DRL and Divatron SR. Presenting Memup, the latest menopausal hormone therapy launched by Jagsonpal Pharma. Memup contains progesterone 100 mg and estradiol hemihydrate 1 mg. Prescribe Memup to manage menopausal vasomotor symptoms. Next, we have Doxipel DR, so doxycycline 100 mg with 5 billion spores of lactic acid bacillus to treat infections. We have Divatron SR 20 mg micronized and sustained release tablets of didosterone to improve compliance and enhance outcomes. Divatron 10 mg tablets also available. Now, a warm and hearty welcome to all the esteemed faculties and attendees. Please note this webinar is streaming live on Facebook and the link has been shared in the chat box. To refer this webinar in future, please visit our YouTube channel Jagsonpal Medical Insight. Now, I invite Dr. Ranjana Khanna. She has taken charge as President Allahabad Menopause Society of Indian Menopause Society and Vice President UPCOG. Currently, she is also ICOG Governing Council member and she has held the office of Vice President FOXY in 2017. So over to you, ma'am, to begin the session.
Thank you so much. First of all, I welcome everybody on board. And it is indeed a pleasure for me to take the charge of as president of the Allahabad Menopause Society. And it is so nice of all the office bearers, current office bearers and immediate past president to be here with us on this day. Thank you all so much. But before we begin, I would like to start with Mahamrityunjay mantra.
Trayambakam yajamahe sugandhim pushtivardhanam urvarukamiva bandhanan mrityurmukshiyamamrita Trayambakam yajamahe sugandhim pushtivardhanam urvarukamiva bandhanan mrityurmukshiyamamrita Trayambakam yajamahe sugandhim pushtivardhanam urvarukamiva bandhanan mrityurmukshiyamamrita.
So a very warm welcome to everyone. At the outset, I would like to call upon the chief guest. Is Dr. Anita Shah there? Has she come? Has she joined?
Not yet, ma'am.
Not yet?
But
So
Dr.
then I
Ragini
would
join
welcome the immediate past president of Indian Menopause Society, Dr. Anju Soni. Thank you so much, dear Anju, for joining. She has been, she is the Vice President FOXY Elect 2026, President IMS, just immediate past president, and Vice President Endometrious Society, Secretary General IMS. She's been the Governing Council member of ICOG and Chairperson HIV and AIDS Committee, where she did a lot of hard work. So Anju, we are very pleased to have you here. She's given so many talks and she has brought IMS to a different height altogether. And I think last year you all had an international conference also. You all went abroad. So she has taken it to another step up. So, so nice of you, Anju, to join. And I would like to say, you to say a few words of encouragement for our Allahabad Menopause Society.
Thank you, Dr. Ranjana. First of all, at the offset, I would like to congratulate the whole new team who have taken over, because I know under your able guidance, the Allahabad Menopause Society would take another height. And as aptly said, menopause, the dawn of new era is a very apt, title, theme given. And I would like to say good evening, everyone. It's my honor to join all of you today as a guest of honor for this timely and important webinar. Menopause is not an end. It's a powerful new beginning. As clinicians, educators, and advocates, we must ensure that every woman enters this phase with awareness, dignity, and care. And this new era calls for empowering education, break myths and with awareness and break myths and normalize the conversation about menopause, because women are scared to talk of menopause. So we must bring in awareness and break myths. There should be personalized healthcare addressing physical, emotional, and sexual health, which is so very important. Collaborative research has to be taken by unifying efforts across, specialties to bring the innovation. And also, we must be able to bring a policy change to recognize midlife women that need immediate care. And for that, as aptly said by all of you, that these changes are very essential for us. And I am especially glad that today's session addresses the very, very important topics: metabolic health and menopause, a topic that is vital given the rising burden of diabetes, obesity, and cardiovascular risk in India. As across the world, we are also again at a higher pedestal. And also menopause and musculoskeletal health, again, that area that is often discussed and is essential to ensure mobility and strength and independence in later years. Menopause is not just a clinical phase. It is a socio-emotional journey. And together we can redefine it as a celebration of strength, wisdom, and resilience. And I congratulate the whole team of Allahabad Menopause Society for this initiative on a very good day, that Tritiya Akshar Day, which is considered one of the very woman days in our culture, and look forward to a session which is full of insight and impact. I'm sure that is going to guide all the practicing menopause specialists how to go about for patient care through this webinar. Thank you very much for inviting me.
Thank you so much, Anju. And has Dr. Anita Shah joined, Amrita?
No, ma'am. But Dr. Ragini has joined, ma'am.
I would love to invite Dr. Ragini Agrawal, who's the Secretary General of the Indian Menopause Society. Ragini has got a lot of dynamic credentials to her credit. She is the president of Indian Society of Aesthetic and Regenerative Gynecology. Ragini has created a furore in that area, and she is the president of Indian Academy of Cosmetic Dermatology and Gynecology, and Secretary General of IMS and Vice President of FOXY. She was in 2020. So she also got the Best Committee Chairperson Award of IMS. She has given a lot of talks, and she is an extremely dynamic and prominent leader of Haryana, should I say, and of FOXY in general. So Ragini, over to you for a few pearls of wisdom for our new budding society, which we are sure we are planning to take it to really great heights now.
Thank you so much, Ranjana ji, for your kind invitation and your kind words. Very good evening to all of you. Whenever an invitation comes from Allahabad, I become a student. So I am here. I cannot think of myself anything more than a PG student. So seeing all my dear friends and can I say colleague or juniors, Urvashi is there, Amrita Chaurasia is there, And so happy to see you all. Manju madam नहीं दिख रही हैं.
मैम
Anyhow,
ज्वाइन
अभी
कर रही
join
हैं, मैम ज्वाइन
करेंगी.
कर रही हैं मैम.
Ranjana ji, I don't think Allahabad is a new society and budding society. It was an established society by,
Yes.
and Anju was installed there. So it was a very, very, I think, a great day when in the Anju's journey and even my journey also as a scientific chair for the that IMS Con in Allahabad. Namaste, Anuradha madam.
Namaskar,
So,
ma'am.
but I wish you very best to
Thank you.
take a new height this Allahabad Menopause Society, and you have started very in a very good way. You're starting from always the basics is a
Yes.
very, very good thing, because we should know the basics of the menopause, which we have not read properly in our curriculum. So physiology and genetics, these two very important topics you are going to discuss with the esteemed speakers and Dr. Mandaki, Dr. Maninder Ahuja as an expert. You are going to do a justice. I think everybody who has joined, they have joined to listen the academics, not me. Thank you so much again, and all the best, Ranjaji, for your future endeavor.
So we welcome you, our scientific expert, Dr. Manju Varma, whom I refuse to let go. And she was the scientific expert through all our series in Isopar Prayagraj when I was the president there. And now, along with me, she has also been requested to shift over to this side of Allahabad Menopause Society.
So
because her-
sweet of you, Ranjana. We have to be together, you know.
yeah, I refuse to let you go. So
I think we can
I-
proceed on instead of wasting the time.
yeah. So at the outset, I want to welcome everyone, and I feel proud to take over the reins of Allahabad Menopause Society. I remember as a child, when anyone turned 40, we used to think, ripe age, and then overripe at 50 and old at 60. So we always thought that, 60 to 80 is very old. But now concepts have changed, and we actually start living at 60. In other words, because, I can say for myself that this is one of the best phases of a person's life. We have changed our mindsets. We all have realized that all our responsibilities of the children, we are free with that, and we are well settled in our life. So now is the time when you can look at yourself, and you can look towards yourself and take care of things which used to trouble people otherwise. Just recently I was in Kolkata, and there I happened to hear a talk by Suvarna Khadilkar on hormonal therapy. And she wrote this is a comic thing what she wrote about menopause. So she writes, beware of the menopause fairy. At first, she steals your figure, then your sleep, then your mood, your patience, your eyesight, finally eats into your brain. She leaves you with a lousy mustache, muffin top, hot flushes, itchy skin, 10 million moods, a dodgy memory, endless needs for naps, coffee, wine, and carbs. So I found it very cute, but nowadays, I don't think we are letting this happen. And we are very much in control of ourselves, our moods. And of course, we have an active lifestyle. We have a healthy diet. We look towards a healthy diet, good exercise. So now that we have taken over the charge of Allahabad Menopause Society, which is an important branch of the Indian Menopause Society, just 2 words about the Indian Menopause Society. This is a multidisciplinary national society which was launched in the year 1995. It is committed to fostering the comprehensive well-being of the mature and elderly Indian women. This society provides a common forum for medical and other health professionals and people from all walks of life to work towards the goals of the society. What are the goals of the society? So just for us all to know, increased awareness about menopause and aging through public health and educational activities, to promote a multidisciplinary, multifactorial, comprehensive approach for the care of these women, and to regularly update doctors and health professionals in the field of menopausal medicine, to facilitate exchange of ideas and experiences, and to collect information and data with reference to Indian women, to encourage research on relevant aspects in the Indian context, and to help provide awareness and services to the less privileged group of women of the society. So these are going to be the goals. And I promise you, we are starting with the basics, but soon we'll move forward. And with these regular academic updates, we are going to go into an in-depth knowledge of the subject, so that by the end of it all, by the end of the tenure, we will be thoroughly knowledgeable about the menopause and the perimenopausal age. And now we will know more and more about this age group with our upcoming webinar.
Yes,
I
we
would
met
like to invite
Nimish-
Dr. Anita Shah, who is the current president of the Indian Menopause Society. Thank you, Dr. Anita, for joining. Everyone knows you are
pleasure,
such a
madam.
dynamic worker of the Indian Menopause Society. And you are a practicing gynecologist in Surat since 1988, president of the Surat OBGYN Society in 2000 to 2001, and organizing chairperson of the
Me
World
too,
Congress
madam.
on
It's okay,
populations.
fine, madam.
Okay, then Dr. Anita ji, we would like you to give your pearls of wisdom and bless us, the new office bearers of the Allahabad Menopause Society.
Yeah. First of all, thanks a lot for inviting me over here, and my heartiest congratulations to you, Ranjana madam, and Dr. Amita for leading the Allahabad Menopause Society. And I do remember we were together at Allahabad conference of IMS, as well as I think
Yes.
Faridabad also. You were there, perhaps Faridabad or Agra. We were sitting together, and first of all, heartiest congratulations and all the best wishes for today's webinar also.
Thank
And
you.
the heading title you have given, it is really very appreciable, because we all know that today in the era of science and technology, we know that all the women passes more than 1/3 of the life in the menopausal age group, and we want that each and every midlife woman should remain healthy and happy till the end of her life. And you all are knowing that the main motto of Indian Menopause Society is also that we want each and everyone fit at 40, strong at 60, and independent at 80. Of course, I have elaborated it to fit at 40, fancy at 50, strong at 60, sexy at 70, independent at 80, naughty at 90, and healthy at 100. We want that each and every woman should be like that. So, but how it is possible? So, unless and until we are aware of all the blues of menopause and midlife, we are taking care of ourselves. So that is the only thing, then only it will be possible for that. So we just teach and we just spread the awareness in all the midlife women that this is the right time. It is the new beginning of your second inning of life. Instead of instead of sitting side aside, you have to develop, you have to use your experience, you have to be the role model for the society, so that each and every woman can get empowered in each and every field and can remain healthy and happy. So I think without wasting much time, again, thanks a lot for inviting me over here, and wish you all the very best for today's webinar. The topics you have chosen, they are also very nice. Let us listen and learn more and more carry-on messages. Thank you.
Thank you so much, Dr. Anita. And I am myself very fascinated by this heading, that it is the dawn of a new era, which I believe it is. So this is the first series. So over to you, Dr. Amita Tripathi, who is the Honorary Secretary of the Allahabad Menopause Society. So welcome Amita on board. And these are two people I never let go. One is Dr. Amita Tripathi and one is Dr. Manju Varma. So they are always with me. So thank you, Amita, for always being there. And now I would hand over the reins to you to carry the webinar forward.
Thank you, Ranjana ma'am, for taking me on every path that you under.
And I would also like to welcome my daughter-in-law, Dr. Parul Khanna, who has also been with me. She was the communicator of ISOPA Prayagraj, and now currently she is the scientific secretary of the program. So over to you, Amita.
Okay, thank you, ma'am. A very warm welcome from my side also to all the faculty and the delegates. I seek blessings from Almighty, my teachers and my elders to handle this opportunity with utmost responsibility. Maheshwari, again, she is professor and head of department of Muzaffarnagar Medical College. We all have seen her as chairperson, FOXY MTP committee. She is governing council member of ICOG, secretary of UPCOG, president of Meerut ISOPAP, and again, she is president of Meerut Menopause Society also. Welcome, Dr. Bharti and Dr. Urvashi. With this, I would request Dr. Urvashi to kindly introduce the speaker for the first session, Dr. Amrita Chaurasia.
Thanks, Amita, for your nice word. And thanks to the organizers for inviting me to chair the session. And the topic is, as everybody knows, is very important, physiology of menopause. And physiology, as we know, physiology of menopause is crucial for several reasons. Recognizing hormonal changes helps to understand all the symptoms of menopause like hot flushes, and the knowledge of menopausal physiology informs us about the potential health risks like osteoporosis and cardiovascular problems. Today, we have Dr. Amrita Chaurasia. She's our friend. She's professor and head of the Milind Medical College, and she's very good speaker. So nice to introduce her. She is convener of Institutional Ethical Committee of Allahabad Medical College. She has teaching experience of 18 years and total publication of 50. She has written chapter on PCOS and ectopic pregnancy. At present, she is Joint Secretary of Allahabad Obs-Gynae Society and she is Scientific Secretary of ISOPAC Prayagraj.
Urvashi, this CV is not updated actually. So that is okay. I am a professor and head department of Obs and Gynae.
And you are Joint Secretary at AOGS. That is also all right.
The AOGS.
Yeah, yes. Right
Good
now,
evening, everyone. Hi, Ranjana ji, Bharti here. Probably I may be disconnected, so I just done good evening to everyone. Yeah, Dr. Ranjana, Dr. Amita, Dr. Amrita, Dr. Ragini, and all menopause society. So together
Dr.
today we
Anita
will
Shah
learn
is
a very
also
important
here.
topic.
Dr. Anita Shah is also here, the president.
Yeah. So nice to see you all, and we are eager to listen the lecture of Dr. Amrita Chaurasia. Yeah.
Hello, ma'am.
I request Dr. Amrita to start her lecture.
So thank you, Dr. Urvashi. So should I start my
please
slide sharing?
Yeah, please.
Yes. So is it visible?
No.
Oh.
Yeah.
Full screen. Now getting it full screen. So is it?
Yes.
Yes. Okay. So at the outset, very good evening to all respected seniors and dear friends, and wishing you all very happy Akshaya Tritiya. And I must say, Dr. Ranjana ma'am and Amita di, this is very good start of this Allahabad IMS webinars. This is Akshaya Tritiya, that means Akshay. That means it will continue. So wishing you all the best and thanks for inviting me and being the first speaker of this series of webinars of Allahabad IMS. So I feel blessed. Thank you so much for inviting me. My voice is also clear.
Yes.
Absolutely clear.
So we will be discussing about the physiology of menopause, because it is very important to understand the physiology, because if you understand the physiology, you will understand the pathophysiology and you will understand the treatment of the condition, whatever you are treating. So to start with, as Ranjana madam has already said, that menopause makes you fatter, your hair becomes thinner. Most of the times you are irritated, having some depression, anxiety, disturbed sleeps, then memory lapses. And apart from that, you also have some physical symptoms also, like vaginal dryness, headache, decreased libido and all. So it is affecting the head, the whole body, starting from the head to toe actually. So by understanding physiology and by understanding the pathophysiology, it is our role to make these women from the depressed one to the joyous one, with full confidence and with full comfort. So just to memorize, it is diagnosed by 12 months amenorrhea in absence of any pathological cause. And the average age is 46 to 48 years, but mean age in India is 46.6 years. And this is very important to understand about the transition period, that is perimenopause, can last about 4 to 10 years and starts even 3 to 4 years before actual settling in of the menopause, and then 4 to 5 years after the menopause settles in. And this period is very important because this period is basically the most distressing period in the woman's life during the perimenopausal and menopausal period. And this period is also important if you understand the physiology of the menopause. This is the period when you start taking precautions, you give some form of hormone therapy so as to avoid the future and late complications and late illnesses related with the menopause. So what happens actually during menopause? We all know that the ovarian follicles are fixed in our ovaries at the time of birth. So by the years, it gets depleted. When we reach menopause, all the follicles are depleted, they are exhausted. So that leads to decreased estrogen and decreased inhibin B, and this will lead to more FSH. So when you want to diagnose menopause, whether she is going into menopause, these symptoms are because menopause, you can just get her serum FSH done. That should be more than 30 milli international unit per ml. But here it is not written, but it is ideally recommended to have two values of serum FSH, 3 to 6, 4 to 6 months apart. So if both the levels are more, you can diagnose that the woman is now entering into menopause. But remember, when the woman is having any form of hormone therapy, this definition doesn't apply. Then just to memorize you that we have all 3 types of estrogens in the woman's body, estradiol, estrone and estriol. The most potent is the estradiol, that is predominant during the reproductive periods, and the least potent is estrone. So, and that estrone is basically predominant during menopause. So, एक तो वैसे ही estrogen कम हो जाता है, and whatever estrogen we are having the least potent variety, that is estrone. So that is why all hypoestrogenic symptoms appear during menopausal period. So if we talk scientifically, I have told you that it affects the whole body from the head to the toe. So starting from the central nervous system, then cardiovascular system, then genitourinary system, then almost all the body's bones are also affected by the menopause. So let us discuss one by one. Yes, this is also very important, that all women, they do feel some of the symptoms of menopause, but they are having a lot of variations in their perception, because after menopause, what happens, the adrenals, they keep on secreting testosterone, and these testosterones are aromatized in the peripheral adipose tissue. So the women who are little fatter, having more of the adipose tissue, they have slightly more amount of the estrogen in their body, so they have lesser symptoms of the menopause. Secondly, changing lifestyle, by changing our diet, by incorporating exercise and yoga, the perception of the menopausal symptoms definitely differ. So the perception of these symptoms may be different when the patients are visiting to you. So we will cover one by one, starting from the VMS, that is vasomotor symptom. The most common one is the hot flashes. So why these hot flashes occur? Basically, again, I must tell you that all the symptoms are related to the decreased estrogen in the body. So hot flashes are basically because of the decreased estrogen, but the role of decreased serotonin and decreased norepinephrine has also been like there in the literature. Because when you know that the estrogen and serotonin and norepinephrine, all three are reduced in the body, so accordingly, you can give treatment to increase the level of serotonin and norepinephrine along with the estrogen. So what do? They increase the LH level, they increase the ACTH level, and they increase the beta endorphins. So, and what do? They go in the hypothalamus and they narrow the thermoneutral zone in the hypothalamus. And because of that, even a slight change in the core body temperature leads to compensatory flushing and sweating. And the woman feels sweating, hot flashes, and even during nights, disruption of sleep because of these sweating and hot flashes. And along with sweating and hot flashes, when you see the pulse rate of the patient and the systolic BP of the patient is also raised. So, but a good thing about hot flashes is this: most women, it resolves after 5 years, but in only 10% women, the symptoms may persist past 10 years. So by 5 years, the body gets adjusted, the woman gets adjusted. So this is good about hot flashes. Then migraine is also a symptom of vasomotor part. What happens to migraine? It may change in the intensity and severity with menopause, because during early menopause, the levels are fluctuating, the estrogen levels are fluctuating. So it may worsen during early menopause, during perimenopause, but after menopause, when the hormones are settled down, most women experience improvement in their migraines. So when a woman with migraine is coming to you, you can explain them. So the basic part that is more worrisome is the women who are having more hot flashes, they are said to be having more risk of cardiac disease and osteoporosis. And the correlation is because of hot flashes, there is increased heart rate, there is increased blood pressure, there is disturbed sleeps. They all contribute to the cardiovascular illnesses in the patients. So this is again very important, because when the woman is coming to you with the hot flashes, okay, she might be a case of menopausal hot flashes, but keep in mind, there are certain conditions, actually common conditions, that may mimic hot flashes, like hyperthyroidism, medullary carcinoma of thyroid, some rarer one like pheochromocytoma, carcinoid tumors, and acromegaly. So you must keep in mind that, okay, most of the time it is hot flashes, but some of the time these should also be considered in the diagnosis when you find suggestive features in the patient. Then certain medications like depot, leuprolide, clomiphene, tamoxifen, raloxifene, even calcium channel blockers, they also lead to hot flashes. So take little drug history from the patients as well. So I'll not go much into the detail of the treatments because my topic is only physiology, but just to touch, first option is lifestyle changes. Second option and the gold standard is systemic estrogen therapy. You know, this is the only symptom, BMS is the only symptom in which we prefer giving systemic estrogen. And this causes 75% relief in the symptoms of hot flashes and BMS. And in the patients who are not fit for estrogen therapy, even high dose progestins can relieve them, but they are not the first option. The first option is systemic estrogen. And then the question is for how long you will give and what doses you will give. The answer is at the lowest effective dose and for the shortest duration of time needed to manage the symptoms by the time her lifestyle changes will take over. Then, like I said, that it is also because of decreased serotonin and norepinephrine. The other non-hormonal options are there: SSRIs, SNRIs, gabapentin, clonidine. And one thing also very important to mention, when the woman is coming to you because of tamoxifen-induced hot flashes, like there are some women who are coming to you, they are taking tamoxifen for the cancer prevention, breast cancer prevention. So in those patients, you will not give estrogen, you will not give SSRIs, rather gabapentin, pregabalin, and clonidine and SNRIs are indicated. So second, the most worrisome, and I think whatever you do, this bone loss is always there in the patients who are menopausal, because the bone mass increases in the childhood and it reaches its peak in the third decade of life, 20 to 30 years. And in that age group, 30, 40, we are so dynamic and so like negligent about our health. Don't take proper calcium, don't take proper milk, don't take proper dairy products. So we are all bound to have bone loss. तो चाहे आप कुछ भी कर लीजिए, ऑस्टियोपोरोसिस सबको थोड़ा थोड़ा सा मेनोपॉजल में वुमेन में रहता ही है. So this is very important to understand that after 30 years, start taking care of your bones, even counsel to your patients also. Because bone loss begins after 30 years, and once the patient attains menopause, the rate of bone loss becomes very high. It gets doubled every 5 years after she attains menopause at the age of 45 to 49, anywhere in between, or even after that. So how does estrogen prevents osteoporosis? Though estrogen receptors are seen in the osteoblast, osteoclast, and osteocytes. And what do? They prevent osteoclastic activity and they promote osteoblastic activity. So whenever you have reduced estrogen, like in the menopausal patients, obviously the osteoblastic activity will fall and clastic activity will increase. So how do they do this? They deficiency of the estrogen, they lead to reduced growth factors. They reduced calcitonin, increased parathyroid hormone, reduced calcium absorption, reduced vitamin D absorption, and reduced collagen synthesis. So all in all, finally, they lead to rapid bone loss and osteoporosis. WHO says that DEXA, we all know DEXA is the gold standard for diagnosing osteoporosis. The normal score is more than -1 and osteoporosis less than -2. So again, touching a little about the specific treatment. Now understand, role of MHT, that is estrogen, is not curative in the patients with osteoporosis. Remember, when the patient comes to you with osteoporosis, you diagnose osteoporosis, don't give MHT for the curation of osteoporosis. It is not for the cure. Rather, it can prevent if you start, like you give estrogen for BMS, you give estrogen for hot flashes during her perimenopausal period. So in that way, it will have additional effect in prevention of osteoporosis. But once osteoporosis sets in, there is no role of MHT. What do you give? Basically, we give biphosphonates, denosumab, and calcium and vitamin D, along with lifestyle, that is exercise and yoga for the bone strengthening. And while I was searching for the literature, I found very interesting novel approach for the treatment of osteoporosis. This may come in the future. Right now, it is under research only. They say that excision of the ovarian tissue in the youth and cryo storage of after the use and cryo stores them, and then after the menopause sets in, they are again introduced into the body to release the estrogen amount, that is physiological amount, that is required for the maintenance of the youth and the maintenance of the bone after menopause. But I don't know whether like when it will come and at what stage the study is, but it is there mentioned in the literature. Then coming to cardiovascular health, estrogen always protects our heart. Till we are having menses, we are having a proper estrogen level, our hearts are protected by promoting vasodilators, by inhibiting vasoconstrictions, and by acting as antioxidant and anti-inflammatory properties. So it has been seen once menopause sets in, estrogen deficiency is there, it leads to coronary endothelial dysfunction. And apart from that, it also affects the body lipids. It increases total cholesterol, and it increases bad cholesterol, that is LDL, VLDL, triglyceride, and it decreases good cholesterol, that is HDL. So in association, the endothelial dysfunction and lipid changes, it increases the risk of cardiovascular accidents after menopause. You can say after 4 or 5 years after menopause, when the estrogen level is very much down and the protective effect is gone. Again, the current recommendation for its treatment, MHT is not for prevention, CVD. MHT is not for treatment of CVD. In fact, it is said once you diagnose CVD, discontinue MHT if she is taking from before. So what is recommended? It is recommended lifestyle management, yoga, exercise, balanced diet, and obviously you will have to refer to some cardiac physician. Then coming to another very worrisome and very distressing symptom, that is GSM. After VMS, this GSM is the second symptom that is very worrisome. The patients are coming to you with the urinary complaint, with the genital complaint. So why GSM has been incorporated together? To know the physiology, the urinary tract and external genitalia both have common embryonic origin. And this explains that both of these organs, they have estrogen receptors. So pathophysiological effect of menopause affects genital as well as urinary structures. So receptors are present in vagina, vulva, and apart from that, also on the urethra, trigone of bladder, and autonomic and sensory neurons in the vagina and vulva. So what happens to vagina after menopause? Vagina becomes thin because estrogen is not there, pale, dry, rugosities are lost. The pH comparatively increases during reproductive years. It is 3 to 4, but after menopause, it is more than even 5. So the protective effect of acidity of the vagina is lost. They are more prone to get infected. Then there is flora flip, that means decrease in the lactobacillus and increase in the pathogenic bacteria. Then macroscopic cellular shift is there. Basal and parabasal cells are more and superficial cells are less. That is sign of atrophy. So all these finally lead to itching. That itching, you keep on giving them antifungal, you keep on giving them vaginal pessaries, but they are not relieved. Because it is not because of fungal infection, it is because of the atrophy in the vagina. So when you give them a local application of estrogen, they will immediately get relieved. So this leads to itching, dyspareunia, dryness in the vagina, recurrent vaginitis because the protective effect of the anti-infection is lost, and general discomfort as well because it also affects their psychology. Then what happens to urinary system? Decreased collagen synthesis leads to weakened pelvic supports and urethral hypermobility. So most of the patients, and I think most of us also who are in this period, we are bound to perceive some or severity of the stress incontinence. Because even if we had like a cesarean section for deliveries, we did not have normal deliveries, then also the women are having stress incontinence, and that is because of the hypoestrogenic, decreased collagen synthesis and weakened pelvic support. Secondly, urethral atrophy leads to poor stream and more residual urine, so more infection and intrusor overactivity is also there. So what happens finally? There is increased frequency in the urination, urgency, urgent incontinence, dysuria, incomplete voiding, asymptomatic bacteria. Let's see, like every symptom of the urological system, the patient may complain to you after she reaches menopause. So how do you evaluate? The evaluation by local examination of this thing, urethral meatus, and local examination of vagina, you can see there are atrophic changes. And when we talk about the investigations, urine analysis along with the urine culture, ultrasonography, urodynamic studies, hormonal profile आप कर सकते हैं अगर आपको menopause diagnose करना है, and bladder diary you can advise the patient to make so as to know about the frequency and the her what is the routine of the bladder voiding during the day. Again, systemic MST is not indicated. Understand. For GSM, remember it is only local estrogen therapy you give to the patient and the patient gets relieved. That is the treatment of choice. Systemic estrogen therapy is not indicated. If she's not getting relieved by the local therapy, then only for a certain period of time, seeing the safer period, you allow her to take systemic estrogen. Then cognitive decline, this is also very worrisome. We have forgetfulness, we have depression, we have irritation, less sleep. So the literature says that the link between estrogen deficiency and depression, cognitive decline, dementia, and even Alzheimer's disease is likely. So, you know, milder symptoms are always there. But the severe symptoms like dementia and Alzheimer's disease has also been linked to this menopause and decreased estrogen. But they are not very sure about this. So using MST for cognitive decline is not indicated as yet, but its preventive role is also under research. So what do you understand by physiology of menopause? To summarize, that physiology of menopause, it is all related to low estrogen levels. But estrogen therapy is not always the answer in all the conditions. I have told you in the beginning, the systemic estrogen is for VMS. The local estrogen is for GSM, for osteoporosis and for cardiovascular illnesses. They are not indicated to be given. They may be preventive when you are using estrogen for some other reason, but they are not therapeutic for these conditions. So choose estrogen therapy and progesterone therapy very wisely, judiciously based on the tailored approach. So like everybody was saying, Maninder madam was saying, Anita madam was saying, Anju Soni madam was saying, Ranjana madam was saying, menopause is not an end, it's rather a new beginning. You are free from the stress, you are free from the responsibilities, you are free from being judged. ये नहीं लगता कि वो क्या सोचेगा, वो क्या सोचेगी. So this is the era of the life that you enjoy to the fullest, but be cautious that keep on checking your health on a periodic basis and incorporate exercise, yoga and dietary changes in your life. So thank you so much. Wishing you all a very happy Akshaya Tritiya and very happy menopausal years and even perimenopausal years, whoever are in this period of life. Thank you so much.
Thank you, Dr. Amrita.
Thank you, Amrita. You have completely finished the topic in a very interesting way. You covered the topic and slides were very beautiful. I was appreciating the slides also.
So Amrita ji said कि
Just
किसी
like-
physiology department से कह दो, हमने कहा physiology वाले फिर वो physiology पढ़ाने लग जाते हैं. That is मतलब like it gets little boring also, और वो हमारे लिए उतना ज्यादा important भी नहीं होता है.
Yes, it was simple and interesting, just like a teacher.
Yeah, Dr. Maninder, would you like to give some comment?
Yeah, I think that was a wonderful coverage about the menopause. Am I audible now?
Yes,
Yes.
ma'am. Thank you so much.
So the thing is, yes, as she said, Dr. Amrita, that menopause is not so easy to understand because that came as a specialty very late in about 1990. So it has been a few years only when we have had the studies about the menopause. So one aspect remains about the regeneration. Can we do it of the ovarian tissue? Like she mentioned, that we can take out, cryopreserve it, and then it. But then that raises one issue, and all of us should be looking into literature for that thing, that the main thing is that women is born with a fixed number of follicles, and that goes on decreasing. That never increases. Even in PCOS, when we are doing ovarian drilling, that decreases the number of follicles and AMH also. So that means this theory about taking out the ovarian tissue is anyway going to decrease the ovarian follicle number of that woman. So practically, I don't think that will be happy. That is an hypothesis only, but that hypothesis cannot work like this. But
they are thinking that if it works for IVF, then it should work here also.
Yeah, but
so madam, medical field is changing every day. They are doing every day new researches.
So, but that is a good Amrita thought process.
Yeah, the thought
where
is good.
all of us should start looking into the literature for that thing now. So that is one carry home message which is very, very important from your talk, and everybody should look into that, whether that is feasible or not. That's all I say. Otherwise, it was wonderful.
Yeah, Dr. Manju Varma, scientific expert. Madam, would you like to say something? Madam, unmute yourself.
Unmute
Madam, unmute kariye.
Only comment I have to make is that she has covered the whole topic like a lecture in which
Like
everything is given, and I must only congratulate her for giving
very
such
nicely
a
said.
precise manner
Yes.
and with beautiful slides. All the things to be covered. I think there's hardly anything which she has left. So congratulations, Amrita.
Thank you, ma'am.
That is all
Thank
I
you.
can say.
And
Your
very
comments
relevant
matter a
and
lot,
to
ma'am.
the point. It was not a drag, and it was a very juicy and a very relevant lecture.
Yes.
Anuradha ma'am ka bhi comment lenge.
Anuradha ji, your words.
Yeah, from my side also same comment. Congrats, Amrita.
Thank you, ma'am.
Wonderful presentation, and you covered everything in such a nice way, and everyone must have get a very crispy message.
Anji.
Thank you, ma'am.
So thank you, everyone. And
Very
with
good.
this,
Anuradha ji was going to say.
First
Yeah.
of all,
Hello, ma'am.
congratulations the
Namaste, ma'am.
new team, Dr. Ranjana ji and Amrita ji. A lot of congratulations to you for
Thank you,
having
madam.
the president
Thank you,
and
madam.
secretary tenure of the Allahabad Society. And Dr. Amrita, you did a wonderful job.
Thank you, madam. Thank you so much.
Very nice presentation. And whenever I listen, pause from anyone, and a good one like you, I learn also.
Arey,
I
ma'am.
revisit, I revisit myself. I revisit myself, and I revisit my menopause. That is
Yes,
the most important thing
this
for
is
me.
the fact.
And yeah, कि मेरे साथ
Anuradha,
क्या हुआ था जी.
Anuradha, that is what I want. Can you send me your narration about the menopause? That is what we want. Nay,
मैं
really,
तो
it's a fact.
yes, I'm telling you, I had my menopause at
That
the
is
age
how
of,
we can get data on Indian women, na?
I'm telling you,
Yeah.
I'm telling you, I had my menopause at the age around 45, 46. And it was sudden stoppage of menstruation, no irregularity. But I had hot flashes and palpitation feeling 5 years ahead before menopause, off and on. But I used to think why it is happening when I was like 41, 42. So then I said, okay, maybe I'm going to have my menopause because I read the subject, I know about it, a lot of night sweatings even before menopause. And it continued after menopause.
And so moving towards the next session, and I hand over the session to our Joint Secretary of Allahabad Menopause Society, Dr. Amrita Agrahari. Over to Dr. Amrita.
Thank you, Amrita. Good evening, esteemed faculties and dear friends. It's my proud privilege to introduce two big names in the Indian Menopausal Society, Professor Maninder Ahuja and Professor Anuradha Khanna, ma'am. Professor Anuradha Khanna, ma'am, she is ex-head of the Department of Obstetrics and Gynecology, BHU Varanasi, President UP Chapter Obs and Gynae 2022 to 24, Founder President of Society of Fetal Medicine UP 2022 to 26, Ex-President of Varanasi Obs Gynae Society, Founder President Varanasi Menopausal Society, Organizing Secretary UPCOG 2009, Organizing Secretary AICOG 2012, Organizing Chairperson UPCOG 2019, Organizing Chairperson IMS Con 2021. There is a huge list of ma'am. See, she's DI Mukherjee IMA awardee 1997, UICC Fellowship awardee 1994 USA, several chapters and books, guided 42 MD thesis and 4 PhD thesis. And our second chairperson is Professor Maninder Ahuja. She is President Society of Meaningful Life Management, Director Ahuja Healthcare and Infertility, President Society of Meaningful Life Management, Vice President Foxy 2023 to 2024.
Wrong hoga.
Yeah, 23 and she has more than 130 publications in journals, textbooks as authors and editors, a thought-provoking leader, website in charge of Indian Menopausal Society, founder Faridabad chapter of Indian Menopausal Society, and
that's all.
Her best
Thank you.
best introduction is a thought-provoking leader.
Yeah.
Thank you.
I request Dr. Anuradha Khanna ma'am to introduce today's speaker, Dr. Milind Shah, and introduce subject.
Okay, first I'm going to introduce the subject, I think. So our own Dr. Milind Shah is a very well recognized person all over India and also all over world. He has been president of ISOPAV in as early as 2016 to 18, and then he had been member of maternal fetal medicine of FOG, and then president IMA, chairman Safe Mother Committee, founder president of IHRF, honorary secretary general of FACP, vice president of WOXC, president elect of ISPAT. I think I've seen
He
your
has
Facebook
become.
that you are already become.
He
Yeah.
has become now.
Yes, I congratulated you also.
Yes.
Deputy Secretary General in SARG, Indian Society of Athletic Registration, ex-chairman, ruler of Sangani, ex-managing committee member, IG, peer reviewer of many journals, and post-steering committee member, Professor HOD, Department of Herbs and Gynecology at Gandhi Natha Medical College, and then visited many countries. I'm not going to enumerate them. Authorized many books in hypertensive disorder of pregnancy, published many national international scientific papers, and credited active Rotarian also. And regarding the subject, sir, you are going to discuss is the very close to all the genetics, rather very close to my heart, that about menopause. Everyone has got the telomere length of different organs and different part of the body and different presentation in their life. Everyone is not the same, they are just different. So with the for the menopause, as I said, my menopause period, it varies normally. That is from the 45 to say 52. But some has become earlier, some has got become later. So there are genes, there are many genes, and there is also microRNA, which will decide further change in the telomere length. So this insert, de-insert, and in the early menopause, there is a flex gene, FMR1, that will have representation in female in a different way, in a male with a different way, and then ANM, the normal type of genes, and then the genes who decides the late menopause. And I am going to listen from Dr. Milind Shah in details, and I love learning from your talk. Thank you so much.
Thank you very much, Dr. Anuradha. It's blessings from you. What I would say that such a kind words for me. In fact, it's indeed a pleasure to be here to speak on this very important topic. But there's very interesting story. In fact, you can see here the date on this. Actually, the talk is 3rd April. Because I went to Allahabad to install Dr. Ranjana Khanna and Dr. Vandana Bansal as a respective, the IMS and the ISOPA presidents. And I'm so happy that Ranjana thought so well to ask me to look into this deeper look at the biological clock. But such a wonderful program that day. We had a lot of fellowship, fun, and the good talks also by me as well as I think Dr. Someone from the other state also. And but then this talk was still remaining that way, and then we thought no, it's getting too late. But when you have dear friends in the society like Dr. Manju and Dr. Amita and Dr. Parul, they say no, you'll have to give that talk. And Ranjana tells that you'll have to come again after 1 month, and she called me within 1 month to give the same talk. I'm really happy about it. I'm very sure this is going to go a long way as a new chapter of the IMS under aegis of Dr. Ranjana and her entire team of Amita, Parul, and Dr. Agrahari. Just now I was listening to Amrita Chaurasia, and very lucidly she told everything about it, and then I realized yes, now it's time to think about the genetics also. And why it happens, because when I met Aishwarya, I was just thinking that Aishwarya, she's looking very elegant, but what will happen when she will become little older? And then I was just wondering about that. And then I saw this picture actually of her mother and two sisters, and I realized yes, she can also be as elegant as actually now she looks as a mother of these two beautiful daughters. And that's what the Dr. Anuradha is the story about the all actually about the menopause. That's why I put this particular caption: the problems are solved not by giving new info, but by arranging what we have known since long. And I realized this recently very much when I started traveling a lot as the Secretary General of the FOPS. That is, many of the things can be actually learned in new way. We can present in new way as well. And all this actually the women on whose name I delivered these various orations, I realized how much they're working so hard how much they were so successful in spite of all those hurdles. When I delivered all these orations, I read biopics of this, I realized that a lot of things can be understood as well, especially Dr. Mukti Sharanam from Ranchi. She used to go on the bicycle to deliver all those women of obstructed labor in 1958. I said, oh my God, we are so lucky to have everything in front of us. And then I got this talk in the our own IMS conference when Dr. Anita got installed, and now I can see her wonderful actually the career as well as a president of IMS to speak on genetics and menopause. And then I thought I must study also on that, because we know that this menopause is significant, because now the women, they are working very very effectively, as we can see at our chairpersons as well, Anuradha and Maninder. Maninder always gives me energy whenever I meet you, and I always feel very happy that yes, I should not be old at all. Though there is no much emphasis on the andropause, but we know that with the age certain things do come. But we try to keep those things away from our working, our enthusiasm, and that's what actually need to come in the coming progeny as well. The menopause is a one point in the continuum of the life stage where a lot of things can happen as a change, because there are changes in the physics. At the same time, there are changes actually in the psychology as well. So one need to work very very hard on that to see that why actually we should change it. Yeah, and this staging, when I saw by Dr. Anklesari of stage 1, stage 2, stage 2B, and stage 3, I said, yes, I can have a lot of things in the prevention also, apart from treating, and just giving the palliative care, when we can avoid that stage as well. That's why genetics has a lot of importance in the menopause, because genetics refers to the heritability, whereas genomics refers how these genes are expressed. At the most fundamental level, genome is the list of all the sequences in the chromosomes, which annotations of genes, introns, exons, which give the regulatory sequences. It can be defined as any study that takes place in global approach to examination of the genome. The DNA microarray is one of the most important tools of the genomics. And I saw these wonderful papers in front of me, which told about the lifespan and the female fertility. There is substantial genetic variation for the common traits associated with the reproductive lifespan. And that's why many of our questions which come in front of us, why we, or why only with me, why not with other, or the mother-in-law saying that हमको भी menopause आया था, and why we didn't suffer, why you are getting those symptoms. We need to understand this synchrony of the various hormones, which differs from person to person, because understanding this genetics behind it is very very important. We understood that certain genes are responsible, the DNA repair appears also be responsible for failure of these expressions. And the scientists, they identified many genetic factors, many estrogen receptor genes, CHEK2 gene, TACR3, and other genetic factors which are involved in actually presentation of the menopause, all the symptoms of menopause, all those complications of menopause, and why there is differences from woman to woman as far as the menopause is concerned. The basically we need to understand that this gene expression is very very variable. The genetic variants are associated with the menopause, occurring earlier or later by weeks or years. The factors that affect age at menopause depends on the early menstruation, also associated with the many other factors, may differ across the racial and ethnic groups. Genes involved in DNA repair and maintenance seems to be involved in the menopause, and dysfunctional DNA repair can lead to accelerated aging and cell death, which can cause menopause. Recently we had a get together of our batch of MBBS exam, the admission, and then we were looking at each other, and everyone used to say that why is looking so old and why is looking so young. I realized that we need to understand this variation in the gene, because this gene can cause actually your menstrual cycle as well, how it can start menstruation earlier or later, how one undergoes menopause earlier than women who did not have those forms of the gene. The result was a reproductive lifespan that was an average more than 6 years shorter as well. what one need to understand is half of the women will experience menopause around the same age as their mothers. The symptoms of many perimenopause like hot flushes, night sweats appear to have some genetic link, what I told you about the expression. Of course, the environmental factors like smoking and other habits and the stress can shift this menopausal age earlier. So we cannot just stick up with only genes. We should also definitely think about the environmental factor and the lifestyle changes also, which we need to emphasize. And I think Maninder, none other than you can tell us about that, about the lifestyle changes when she works on that particular noble cause, untiring actually with the effort with all her members actually with her. The age you reach menopause may be a trait you inherit. On average, daughters reach menopause about 1 year earlier than their mothers, meaning that some reached it earlier and some later. One study found that about half of the 164 daughters surveyed reached menopause approximately 1 year before their mother. And researchers believe that the similarities are caused by genetics, similarities in the environment, and sometimes the combination of both. So this need to be understood very, very clearly. This is another actually the paper which is again very important paper about telling about genetics of early and normal menopause, and which again told that not only the genes, the DNA repair is responsible for failure to reproduce and the subsequent occurrence of menopause. One need to take into consideration into that. Similarly, there is another paper by Camilla Thasneem on the pathogenesis of its associated diseases, a very systematic review where it concluded saying that the genetic aspect of early menopause as well as all actually the etiological factors and the expression, all those biomarkers have some genetic correlation is associated with that. So there is always this $1 million question which is put whether this onset of menopause is a age a genetic factor, and it has been proved now that yes, it is definitely. But of course, we need to have little more actually studies, more research about this particular genes as well to understand. And again, about the experiences also, we need to correlate with their genetic pattern. The symptoms you experience may also be similar like mother. Research has shown that hot flushes are associated with the specific genes, and that's why some of them they say we never know actually what the hot flush was. The aunts, sisters, and grandmothers may have similar experiences, and the other research has also shown that certain genes make people more susceptible to hot flushes if they smoke. So it is very essential to understand that not only the genetic factor, the environmental factor, your lifestyle, everything goes hand in hand to give expression of that particular gene, and the stress of course doesn't need much emphasis. There is always a lot of study has been done on this gonadal degenesis also through menopause, and they realize that there are certain genes which are responsible, which are actually essential for expression of having this gonadal degenesis when the woman reaches and when she loses all her oocytes as well. So the genetics play a strong role in the determining age of the menopause as well as overall longevity. Now, just now we heard about this wonderful story of the mother of Dr. Anuradha. Very true that they were very successful even with advanced age. But unless and until we come out with some actually the answers to all these variations, we cannot come out of it. And that's why when recently we were part of this very interesting story of clinical phenotypes and genetic regulation of endometriosis in Indian women, we realize that yes, we are missing on certain facts which are not revealed properly. And fortunately, my both centers in Sholapur as well as Mumbai were chosen for this particular multi-centric study where we used to have a lot of big questionnaire which was prepared by ICMR of 16 pages. We used to ask them what they're eating, what they're cooking, how they are cooking, which utensils they are using, what are their habits, what about their menstruation pattern, and all those things were correlated to come out with a wonderful result out of it, which we are going to publish very soon. And we used to collect the samples as well from all those women and the controls of exactly same matching to identify whether we are going to identify any new genes in that particular woman. It was for endometriosis. But let us come under aegis of the IMS for the menopausal active study as well, which I can inculcate as we go little more as well. I don't know whether you can see this video.
We can.
It is seen good, yeah.
Yes,
This
we
is
can see.
actually how it is. We always say that yes, the age, which always makes us a bit nervous, but inside we could be as beautiful as you can see here as well. So that's how actually we should treat menopause, and we should always deal with the menopause when it comes to us. This was the Harley Davidson's best promotion, the commercial as well. But again, I emphasize all these wonderful experiences you all are having, which we must publish it properly to come to some conclusion as well. And before leaving this particular platform, let me put a humble appeal once again to all of you. I know that the Allahabad, the Banaras, and so many societies they love me, and that's why they invite me so repeatedly. In fact, I'm again coming to Allahabad next month when I realize there is something very interesting happening. I seek your blessing for the Foxy Present 2027 to inculcate more research, more academics, more changes in our Foxians, and I'm very sure it is going to happen. All of you have received this diary, but I'm going to send it again by post. I'm very sure it is going to go a long way as well to make the better changes, not only for the menopausal women, but also for all Foxians as well. Thank you very much, Dr. Ranjana, Dr. Amita, Dr. Manju, Dr. Parul, and Dr. Agrahari for this wonderful invitation. And my bucket list of delivering this talk in Allahabad got fulfilled by this webinar. And must say appreciation to Ranjana. You said it and you proved it a few days earlier because she was saying first week of May and it happened in the last week of April itself. It is, of course, because of the support you get from Dr. Manju and Dr. Amita. Thank you very much.
Actually, I
Thank
felt bad that day because we got late and you could not deliver your second talk.
I know.
So it was at the back of my mind that we should start now the web series and we should include Milind in that.
So sweet of you. Thank you very much. Thank you, Ranjana.
Thank you, Milind sir, for such an elaborate talk, and best wishes for your presidentship. And I now request Dr. Maninder Ahuja ma'am for concluding remarks.
Thank you, Amrita. But before I talk about Milind, Milind is a lifelong friend for me. We have been together from the very beginning in Foxy in all the functions. And later on, I'll come to the details. But first, I have to congratulate my dear friend Ranjana Khanna and really welcome you on the helm of affairs of Menopause Society. Because we need leaders like you and your team, Amita Tripathi and everybody who is there to help you out. And I'm sure that under your guidance, it is going to grow like anything because you now have the experience, the skill, and the will to work. And your second innings of life, the menopause, it comes like this. So that is it. So now we come to the Milind Shah. He has defeated andropause. So let's cheer for him. He has also defeated andropause. You cannot tell his age. And we wish him well for all his presidential efforts and all that. And we are with him. Now, as far as the topic is concerned, I think that is the most important topic, Ranjana, you have selected. Both your topics are wonderful, physiology and then going on to the genetics. Now, the fact is that we are living longer. We are living longer. The age at the time of independence was about 40 years. Many women did not even reach menopause. Now it's more than 80 years. 76 is the official, but practically we see that the people are living in the 80 and 90 years. But the fact is that going into the healthy aging? That is where we have to go look into the genetics, where they are being affected by the epigenetic changes, which are changing into genetic changes. Now, because if we are not living healthy, so whatever life expectancy we have increased, that is going into the unhealthy life years only. So that is not creating a healthy society, and billions of dollars of expenses on the governments for creating the infrastructure for them. And added to that is our adolescent population is decreasing because we want the population control. So where are the working hands? So all of us have to become the working hands of the countries now. So we have to remain healthy. What Milind wanted me to ask was how I have changed, or how I try to keep. Long years back, I realized the effect of exercise in 2000, I think. And I started talking on that because why the gynecologists and the physicians, they are not talking about that? Because I felt those changes in my life when I started doing the exercise in a proper way. Not we have done a Surya Namaskar, hum to roz karte hain. So that is not the way of doing the exercise. You have to bring those epigenetic changes to lengthen the telomere length. That does change. And they have shown in cardiac study that when we have the proper nutrition, proper exercise and sleep. Sleep is very important part of that. We will have a healthy aging and telomere length. They have measured them practically, experiments. They have measured that it has increased. So without taking, I think we have finished our time. So without going further details, I again congratulate Dr. Milind Shah and Dr. Amrita also for Chaurasia for her wonderful talks. And again, Ranjana Khanna and Dr. Anita Shah, our president, IMS, whether she has left, I think, because she has so many things to do at her hands now.
No, she's there.
Anita, yeah. Anita, I'm there with you all the time and sympathize with you because 1 year means a very hectic 1 year that way with the national, international conferences everywhere going around, but she'll do well. And so our other office bearers also. And without mentioning Anuradha Khanna, how can I end? If I was a doll, you were a doll to me also. Because we have been so affectionate whenever I went to their place. I mean, I visited very few times UP, but whenever I visited UP, I had the love and affection of UP walas in their own style. And so we had a wonderful chit chat, I think.
Also.
Yeah.
When I had been to Prayagraj conference also, then we had been to Varanasi and I met Madam and Madam was really gave me such a lovely hug and good hospitality. I do remember.
I think Ranjana, you will feel very happy here because somehow the other Indian Menopause Society still remains a family sort of a behavior. So we are very happy together and we try to make everybody happy around us. So happy and healthy aging is the genetics of Milind Shah, which we have to carry forward. And Milind, I think in the future coming years, we'll have more collaborations with you from
Definitely,
the other society.
definitely.
One thing, Dr. Milind, one thing I will like to add, and to Dr. Maninder, you also, that on top of every health is the mental health.
Yes.
Yeah, mental health.
On
I
the top
agree.
of
So that
every
is why I
health is
said the
mental health.
happiness is the one thing which has to
It's
be
very,
there
very
along with it.
important.
Yeah.
And
Serotonin,
happiness is there when you
oxytocin,
are happy at
endorphins.
heart.
बहुत
Somewhere I
important.
was reading that in the morning, if you are doing your walk, just keep on smiling all the time.
Yes.
So that will, really pep you up. And laughing, you have these laughing rituals going on in all these parks you see nowadays.
The first time in IMSCON, I had the workshop on laughter. Laughter, the best medicine.
Yes.
I had a practical workshop of that. And we all of us laughed and that was from Gujarat. Dr.
Surat had enjoyed the workshop by Maninder in 2007 or 6, I think. We started. She inaugurated our club
I was the chairperson. Yeah, I just started into the Menopause Society. And I had gone there for public awareness
Maninder, I
meeting.
do remember you made my mummy dancing.
Yes. Call her. Your mummy is still there, Anita?
Yeah, no, I left.
She left. She left. Okay. Otherwise, when I'm coming to your CME, I could have met her again.
Right.
Actually, when happiness, it always comes to you when you meet people. I was so happy that I came to install. I went to when Ranjana got installed. But also I was very much there in Kanpur when Dr. Anita got installed as IMS president. It was such a wonderful moment. Could see actually the wonderful work done by Anju and now what Anita is going to do. And then while coming back, we traveled together, me and Maninder in a Vande Bharat, I think,
Vande
express.
Bharat. By chance, accidentally, we were.
Yeah, and it was such a wonderful experience because we went to that Kora Makanpur and it was such a wonderful interaction and the exchange of knowledge. Thank you very much.
Thank you, dear faculties. Now I hand over the session to Dr. Parul Gupta Khanna, and she will take up question answers and vote of thanks. Over to Parul.
Thank you, ma'am. I don't see there are any questions. So I will propose the vote of thanks.
But before that, Parul, take comments from the scientific expert.
Yeah.
Dr. Manju Varma.
Manju Varma, yeah.
Yeah, ma'am.
Thank you. Thank you.
Yeah.
Again, I would like to congratulate you, Milind, and giving the insight into the topic of menopause, because today is an era of prevention. If you know that the person is going to get menopause earlier, she's more likely to have some complications, and if she is going to have a late menopause, she is also going to have some other complications. So we can beforehand find out and take the preventive actions. And this is one thing which is very, very important nowadays. And we don't go into the very much detail of X chromosome or chromosome 9 and all those genomes that are responsible. But the clinical aspect is very, very important, that we must know. If we know, then we can take preventive actions for what are the complications that can later on come in life. Thank you. And I would like to say everything lies over here. If you are contented with what you have, you will always be happy and will be almost all the time free from disease.
Great, great.
Thank you.
Wonderful.
Thank you, everyone.
See, I'm doing two projects. One is the relationship of menopause to metabolic syndrome. So I got a Google Forms. So I trained my staff to ask all the patients to have that forms filled. So that is the where they know their symptoms also. So we tell them these are the symptoms you might get, and when you get those symptoms, please come back to us. Now we are just testing you for metabolic syndrome, but later on you might have many more syndromes again.
This time,
so, but be in touch with us.
This time when we were in Kolkata, so I was just saying on the last day, I said, see, we women are protected from cardiac problems basically because of estrogen. So that was, I was saying in context of Dr. Niranjan Shah getting the MI.
Yeah,
so
correct.
I said, we females are protected. So Ashish Mukhopadhyay says that, what do you say? Should we start taking estrogen also? I said, well, it's your wish.
I think if they have a cancer prostate, they are given estrogens.
So Parul, now you can propose your vote.
Yes, yes.
At the outset, I begin with thanking our chief guest, Dr. Anita Shah, ma'am, the president of Indian Menopause Society, for blessing the webinar and our new team. My heartfelt thanks to our guest of honors, Dr. Anju Soni, ma'am, immediate past president of IMS, and Dr. Ragini Agrawal, ma'am, secretary general of IMS, for sparing their valuable time and blessing the webinar. My sincere thanks to our organizing chairperson and president of Allahabad Menopause Society, Dr. Khanna, ma'am. Under her leadership, we are sure that Allahabad chapter of IMS will grow leaps and bounds. My thanks to our speakers for the webinar, Dr. Milind Shah sir and Dr. Amrita Chaurasia ma'am, for taking us back to the basics of menopause, the physiology and the genetics, and clearing our concepts. My sincere regards to our experts for the webinar, Dr. Anuradha Khanna ma'am, Dr. Maninder, Ahuja ma'am, Dr. Bharti, Maheshwari, and Dr. Urvashi, Barman, for sharing their valuable inputs and also their personal experiences. My thanks to our scientific expert, Dr. Manju Varma ma'am, for her words of wisdom. Also, my thanks to my co-conveners, Dr. Amrita Tripathi and Dr. Amrita Agrihari, for the coordination and the organization of the webinar. Last but not the least, my thanks to all the participants for making the webinar possible and our academic partner, Jagsonpal Pharmaceuticals, and Dr. Deepika Chhabra. At the end, I would end by saying and repeating Dr. Maninder Ahuja words, wishing everyone a happy and healthy aging.
Thank you. Just say cheese, we will have a group photograph. Cheese.
Yes. Cheese.
Yes, click. Okay, bye-bye.
Bye.
We'll leave now. Yes.
That.
So I thank you everyone for joining in today. The session was brought to you by Nari, Boniva and Fembon division of Jagsonpal Pharma, makers of Memup, Doxipal DR and Divatron SA. So Doxipal or Memup, the latest menopausal hormone therapy launched by Jagsonpal Pharma. Memup contains progesterone 100 mg, estradiol, hemihydrate 1 mg, and it has been prescribed to manage menopausal vasomotor symptoms. Doxipal DR, which is doxycycline 100 mg with 5 billion spores of lactic acid bacillus to treat infection. And lastly, Divatron SR, that is 20 mg micronized release tablets of ditosterone to improve compliance and enhance outcome. Divatron 10 mg tablets are also available. So I once again thank you everyone for their wonderful insights and knowledge, and we look forward to your participation in the next webinar.